Frozen dinners are often marketed as convenient lifesavers for busy people, quick meals that require minimal preparation. But for individuals with high blood pressure, they are a quiet but potent dietary hazard. On the surface, they appear harmless, neatly packaged portions of meat, vegetables, and starches that promise a balanced meal in minutes. But beneath this convenience lies a hidden storm of sodium, preservatives, and sometimes unhealthy fats, all of which can contribute to elevated blood pressure and long-term cardiovascular damage. The most immediate danger is the sodium content. Frozen dinners are notoriously high in salt, which is used both as a preservative and to enhance flavor. A single frozen meal can contain 800 to 1,500 milligrams of sodium, or even more, depending on the brand and type. For someone with hypertension, consuming just one of these meals can deliver nearly, or even more than the entire recommended daily limit of sodium. Sodium causes the body to retain fluid, increasing blood volume and forcing the heart to pump harder with each beat. Over time, this constant strain can stiffen arteries, damage vessel walls, and exacerbate chronic high blood pressure. In other words, a quick dinner can silently turn into a daily cardiovascular stressor. But sodium is not the only problem. Many frozen dinners also contain preservatives, artificial flavorings, and sometimes trans fats, which collectively worsen vascular health. Preservatives like monosodium glutamate, MSG, or phosphate additives can trigger temporary spikes in blood pressure, inflammation, and oxidative stress, particularly in sensitive individuals. Trans fats, present in some pre-cooked sauces or fried components of frozen meals, promote plaque formation in arteries, reduce elasticity, and compound the hypertension risk. Unlike sodium, which causes fluid retention and acute pressure spikes, these additives contribute to structural and functional damage over time, creating a cumulative assault on heart and kidney health. Another subtle risk comes from portion sizes and consumption habits. People often consume multiple frozen meals per week, or even daily, assuming that one meal at a time is harmless. Yet each serving silently contributes to a cumulative sodium and preservative load that strains the cardiovascular system. Repeated exposure amplifies arterial stiffness, kidney stress, and fluid retention, while increasing the risk of long-term complications like stroke, heart attack, or chronic kidney disease. Children and teenagers are particularly vulnerable if frozen meals become a regular dietary habit, as early high-sodium exposure can establish lifelong patterns of hypertension and vascular risk. There's also an indirect danger associated with frozen meals. They often contain refined starches and sugars, especially in side dishes or sauces, which promote weight gain and insulin resistance. Increased body weight is itself a major contributor to high blood pressure, and insulin resistance can further impair endothelial function, the very lining of blood vessels responsible for regulating blood pressure. In combination, these factors mean that even seemingly balanced frozen dinners can accelerate multiple pathways leading to hypertension and cardiovascular disease. Practical awareness is critical. While frozen dinners are undeniably convenient, people with high blood pressure must read labels carefully, check sodium content, and avoid those with more than 600 to 800 milligrams of sodium per serving if possible. Seeking low-sodium alternatives, supplementing with fresh vegetables, and avoiding meals with processed sauces or fried components can help reduce risk. Ideally, frozen meals should be the occasional backup, not a daily staple, because their hidden sodium and additive content can stealthily undermine blood pressure control and overall cardiovascular health. In short, frozen dinners are a modern convenience with a serious hidden cost for hypertensive individuals. They're loaded with sodium, preservatives, and sometimes unhealthy fats, all of which combine to raise blood pressure, damage arteries, and strain the heart and kidneys over time. Regular consumption can quietly escalate the risk of stroke, heart attack, and chronic kidney disease, making vigilance essential. For people managing hypertension, minimizing frozen meals, choosing fresh or minimally processed alternatives, and reading labels diligently are not just lifestyle choices. They are critical strategies to prevent long-term cardiovascular complications.